Hi there, folks joining us for a webinar, special JES event. So grateful to have you all with us as you're coming in. We are also on Facebook, the JES's Facebook page, which I'm going to take us live to now. So just ask for your patience as we get ready to begin this event. Again, thanks to everyone joining us on the Zoom webinar. Appreciate you coming to today's special event featuring Damali Donovan, talking about youth homelessness, a primer. We are going to begin the event shortly. So again, thank you for your time and attention.
I'm not seeing it on Facebook, Ben.
Yeah, Andy, I am not seeing it as well. Thank you for that heads up. It looked like there was a hiccup in our go live feature. Folks in the webinar, thanks for your patience. We appreciate you showing up here. Okay, you know what they say, a second time's a charm. So I do think we are successfully now on Facebook. Thanks again to those in the Zoom webinar for your patience. And Dr. Roth, thank you for your quick eyes in finding that. And of course, thanks to Damali Donovan, one of our Raimy fellows, to be here to present. So with that all said, I'm going to go ahead and start the event and say hello and welcome to a special Jefferson Educational Society virtual event. Youth Homelessness, a primer. I'm Ben Spagan. I'm the vice president at the JES. This event is part of the JES's Raimy Fellowship Program, an additional optional track of the JES's Civic Leadership Academy designed to offer an enhanced opportunity for participants to hone their leadership skills and complete individualized guided research on critical issues facing the region, the state, and or the nation. More on that from Dr. Roth in a minute. But before I introduce the director of the Raimy Fellowship Program, who will introduce our presenting Raimy Fellow, I'll run through some housekeeping. We are hosting this event on both Zoom webinar and are live streaming it on the JES's Facebook page. Now, if you're attending via Zoom, please feel free to interact with us using the Q&A function. As following the presentation, we're going to take as many questions from you, the audience, as we can in real time. Now, if you're tuning in live on Facebook, leave us your questions and comments in the comment section of this post. And again, we're going to work our way to work through as many of those questions as we can following the presentation. Now, if you happen to be listening to or watching a later broadcast of this program, streaming it on demand, still send us your questions, your comments to keep this conversation going either on the JES's Facebook page or on its YouTube channel. And for more information about upcoming JES programs and publications, visit our website, jeserie.org. Be sure to like us on Facebook, connect with us on LinkedIn, follow us on Instagram, and subscribe to that YouTube channel. And now to introduce our Raimy Fellow, I'd like to first introduce my JES colleague with whom I have the absolute pleasure of working with, Dr. Andrew Roth. Some of you might know Dr. Roth as a JES scholar in residence or from his numerous lectures that he's delivered at the JES and many other places over the years, many of those rooted in exploring his American Tapestry project, which is also a podcast on WQLN NPR. Or you might know him for his some 180 installments and counting of book notes, which he authors weekly, or as a member of the JES's Board of Trustees, or as the interim director of the Brock Institute, or from his decades in higher education and from lecturing to leading, and serving as president of not one, but two universities. He is, of course, all of that and much, much more. But here I'm introducing him as the director of the Raimy Fellowship Program. Andy, thank you so much for all you do, not just for the JES, but beyond, but especially here directing the Raimy Fellowship Program, teaching, mentoring, guiding these fellows through a terrific learning opportunity and an impactful research project. Andy, this is where I turn things over to you.
Thank you, Ben. Thank you for that introduction. The real star of our program this afternoon, however, is not me. It's Damali Donovan. Damali is a member of what we call the Raimy Fellows Program at the Jefferson Society. The Raimy Fellowship Program, I think we're in year 6 or 7. It was founded in reply to or in response to a request by alumni of the Jefferson Civic Leadership Academy for a program that would help them understand leadership theory a wee bit, but more importantly, give some fellows the opportunity to do independent research. And Damali is going to do a presentation this afternoon. She's calling it a primer, but she's going to introduce you to the challenge and the problem of youth homelessness, not only nationally, but also in Erie and Erie County. Damali is currently the community school support manager at the United Way of Erie. She's been with the United Way for 5 years, initially as an AmeriCorps Vista volunteer, and then later and currently as a full-time employee. Damali focuses on education, health, and holistic development. She's dedicated to positively impacting communities' well-being. In her free time, she's always seeking out to expand her knowledge and loves immersing herself in new ideas and concepts. Damali is also an intrepid person. She actually hails originally from the U.S. Virgin Islands and somehow has adapted to Erie's winters, although recently we haven't had much of a winter, at least by Erie standards. We haven't had much of a winter, but even our mild winters are, I'm sure, as Damali can tell you, significantly different than winter in the Virgin Islands. Be that as it may, more importantly, Damali is going to talk to you today about youth homelessness, and she's going to define homelessness, one of which definitions is the lack of a safe, permanent place to live. It might startle some of you, and then others of you viewing today's program, I think, live this, not live it necessarily as a homeless person, but live it as someone trying to ameliorate the problem. There are more than 1,100 people who use emergency shelters each year in Erie County, and that number is increasing. In fact, over the last 5 years, it's increased about 15%. Particularly at risk are young people. And usually, I think, perhaps I'm wrong, when most people think of homelessness, they think of an older person. By older, I mean someone at least in their 20s or 30s, if not significantly older than that. But they rarely think of it as impacting young people. And in point of fact, young people are a prime concern of those who are working on the problem of homelessness. And so today, Damali is going to give youth homelessness a primer, an issue she became much concerned about as she got involved in the Erie community and actually met a gentleman named Danny Jones who explained to her what is going on. And as a result of that interaction, she's become acutely interested in it. And today, she is going to give us a primer introducing us to the concept of homelessness so that we understand what that is, the notion of youth homelessness so we understand what that is. Then she's going to share with you at least 2 programs nationally that might have some applicability to Erie, and we'll conclude with a question and answer period from the audience. So with all of that, Damali, I'm going to turn it over to you.
Thank you, Dr. Roth. I'm so glad to be here. And thank you to everyone tuning in. Greatly appreciate that. So as Dr. Roth mentioned, my topic is youth homelessness, a primer, and I've been interested in ever since I had the conversation with Danny Jones, who expanded my definition of homelessness, because before it was just pieces of what the media, like TVs and books, portrayed homelessness as. So it's just great that to see the work that is happening in Erie and then elsewhere in the nation. As mentioned, I'm going to go over a general definition of homelessness, then further define youth homelessness, talk about some guidelines that the federal government has put out for ending and preventing homelessness, connection to Erie County, learning from other successful models in the nation, and then just going overall of a concluded statement of the overall agenda. So, what is homelessness? The U.S. Department of Housing and Urban Development, or HUD, defines homelessness as a state experienced by an individual or family who does not have a permanent and regular place to spend nights. This definition is further broken down and explained into 4 categories. The first of the category is literally homeless. This refers to an individual or family who do not have a fixed, regular, and adequate place to stay at nighttime. These include people who live in a public or private place not meant for living, such as streets, parks, or cars. Those staying in shelters provided by charities or government programs. People who have stayed in emergency shelters or places that aren't meant for, not meant for living just before entering an institution. The next one is imminent risk of homelessness. So as the name implies, those are on the brink of homelessness. So 14 days prior to applying for homeless assistance. And they also lack the necessary resources to get back on track and find permanent accommodations. Fleeing or attempting to flee domestic violence. I would like to pay particular attention to this because fleeing or attempting to flee a violent home is a significant factor contributing to youth homelessness and can be a dangerous but sometimes necessary consequence. So youth could be escaping from violence. They might have limited options, and limited options lead to them doubling up or couch surfing, which I will talk to you about later on in this. It's unstable and inconsistent, and it exposes individuals and families to potential exploitation. Homeless under other federal statutes. So that includes the McKinney-Vento, the Public Health Service Act, and the Runaway and Homeless Youth Final Rule. The Public Health Service Act defines homeless individual as an individual who lacks housing without regard to whether the individual is a member of a family, including an individual whose primary residence during the night is a supervised public or private facility. The Runaway and Homeless Youth Final Rule refers to youth experiencing homelessness and are individuals who cannot live safely with a parent, legal guardian, or a relative, and who have no other safe alternative living arrangement. This usually refers to those within the ages of 18 to 22. So what is youth homelessness? This category encompasses unaccompanied youth, families with children, and youth who do not meet the standard definition of homelessness, but are considered homeless under other federal statutes. These individuals or families have not had a lease, ownership interest, or occupancy agreement in permanent housing for 60 days or about 2 months before applying for homeless assistance. I will focus on the McKinney-Vento Act, which applies to children and youth aged 21 and under, and is administered by the Department of Health and Human Services Office of Child Care. This act authorizes the Federal Education for Homeless Children and Youth program and is the primary source of federal legislation for educating children and youth experiencing homelessness. It mandates that all school districts appoint a homeless liaison. The role of the homeless liaison is to identify homeless students, enroll them in school, connect students and families to resources, and support advocate for academic success by removing non-academic barriers to learning and ensuring continuity of education. They communicate and collaborate with school staff, social service agencies, and community partners to ensure a coordinated approach to supporting homeless students. school districts and homeless liaisons play a critical role in upholding the McKinney-Vento Act and ensuring educational stability for children experiencing homelessness. The Act defines homelessness in 4 clauses. The first clause refers to children and youth who are sharing the housing of other persons due to loss of housing, economic hardship, or a similar reason. Or they are usually living in motels, hotels, trailer parks, or camping grounds due to the lack of alternative adequate accommodations. They are living in emergency or transitional shelters, are abandoned in hospitals, or are awaiting foster care placement. Clause 2 refers to children and youth who primary nighttime residents, includes living in shelters, transitional housing, cars, parks, other areas not intended for human habitation. The third one are children and youth who nighttime residents who find themselves in challenging situation of residing in vehicles, parks, public areas, deserted structures, inadequate housing, or transportational terminals such as bus or train stations. The last clause is migratory children. Under the Erie Student Succeeds Act, they are defined as a child who works or whose parents work seasonally or temporarily in the agriculture or fishing industry and who have made a qualifying move in the previous 36 months. They qualify as homeless because of the children living in circumstances described in clauses 1 through 3. This slide does not relate to the McKinney-Vento, but it is an important topic to bring up. Unaccompanied homeless youth, which refers to any individual under 18 who is not in the physical custody of a parent or guardian. This encompasses youth who have run away from home, have been expelled from their home, have been forsaken by parents or guardians, or have been separated from their parents for any other cause. So as I mentioned earlier, doubling up and couch surfing is something that we see a lot of youth doing. So doubling up refers to the situation where individuals live with friends or family due to economic hardship, violence, loss of housing, or any other situation. Although it is technically not considered as homelessness, it is a precarious situation that significantly impacts families and individuals, especially young people. While these individuals are not technically living on the streets, this situation often is referred to as hidden homelessness. Doubling up leads to being undercounted in official homeless statistics, an increased risk of homelessness, and can disrupt access to education and healthcare, as well as the overall well-being of those experiencing doubling up. It strains resources by sharing overcrowded spaces, leading to stress and tension, and stretches resources such as food and utilities thin. This situation also increases vulnerability to abuse, food insecurity, and mental health problems. So examples of doubling up would be situations where family lives with extended family due to eviction and inability to afford rent. It can also refer to a young adult couch surfing with family members or friends for an extended period of time. So there are federal guidelines that are created to help provide guidance on how to end and prevent homelessness. The United States Interagency Council on Homelessness has recognized that solving homelessness cannot be achieved by a single agency, organization, level of government, or sector alone. It requires coordination, collaboration, and a continuous exchange of ideas. To address this, the United States Interagency Council on Homelessness developed plans for joint action with its 19 members and local and state partners from both public and private sectors. These plans aim to realign existing programs based on best practice at the local level and allocate resources effectively to prevent and end homelessness in America. Opening Doors outline is the nation's first attempt at a comprehensive strategy to prevent and end homelessness. It outlines strategies for the federal government to collaborate with state and local government, as well as public and private sectors, to implement cost-effective, comprehensive solutions to end homelessness. The plan consists of 10 objectives and 52 strategies that contribute to achieving 4 main goals. The 2015 amendment shifts the timeline to 2017 and focuses on restructuring homeless programs into crisis response systems, clarified Medicaid's role in covering services that promote housing stability, and emphasizes the strategic use of data. The framework to end youth homelessness is a very comprehensive strategy to eradicate youth homelessness by 2020. Its core principles focus on 2 key strategies: coordinated community planning and evidence-based interventions. The framework has 4 core outcomes for all youth experiencing homelessness: stable housing, permanent connections, education or employment, and social emotional well-being. It focuses on 2 complementary strategies: data strategy, getting better data on the numbers and characteristics of youth experiencing homelessness, and capacity strategy, strengthening and coordinating the capacity of federal, state, and local systems to act effectively and efficiently toward ending youth homelessness. Although the 2020 goal of ending youth homelessness was not achieved, the framework to end youth homelessness remains a very valuable resource for communities and organizations. It continues to provide effective strategies for preventing and addressing the complex issue, reinforcing its ongoing relevance and applicability. Home Together focused on federal strategies that supported states and communities in making homelessness a rare, brief, and one-time experience and sustaining that success once achieved. That focus is reflected in its structure. Expanding the toolbox. 2 of the most essential tools in the toolbox to end homelessness are trauma-informed care and affordable housing. When combined, they create housing stability for vulnerable populations. Strategic plans to prevent and end homelessness should go beyond just providing subsidized housing assistance. Families and individuals and them that themselves experience homelessness due to a variety of circumstances that impact their lives and responses to those circumstances. The United States Interagency Council of Homelessness recognizes that the life stories of families and individuals experiencing homelessness are diverse, and not a one-size-fits-all approach is inadequate to meet the needs of every family or individual. Expanding the toolbox offers a new approach to significantly reduce homelessness by engaging individuals with trauma-informed care while focusing on the importance and power of the dignity of work mental health and trauma-informed care, affordable construction leading to affordable housing, prevention will save money while reducing trauma, the need for population-specific programming, renewed focus on racial disparities, promotion of alternatives to criminalizing people experiencing homelessness, and importance of national emergency readiness. All in, the most recent federal guideline to ending and preventing homelessness was developed in response to the increasing homeless crisis caused by the global pandemic, COVID. It aims to assist communities continuum of care by providing guidance. All in sets out a strategic vision for a future where no individual experiences homelessness, ensuring fair access to secure, stable, and affordable housing for all Americans. The plan has two goals: an ambitious interim target of reducing homelessness by 25% by January 2025, and the ultimate goal of making homelessness rare, brief, and non-reoccurring. The plan is built upon 6 core pillars. Equity integrates principles of racial and social justice to address disparities in homelessness across diverse populations. Data leverages data-driven decisions making and evidence-based practices for continuous improvement and optimization of strategies. Fosters strong partnerships among federal, state, local, and tribal governments, nonprofit organizations, and the private sector. Prioritizes expanding access to affordable housing and comprehensive supportive services, including healthcare, employment assistance, and mental health resources. The homelessness response aims to streamline and enhance emergency response systems, ensuring efficient and effective interventions. Also invest in proactive strategies to address the root causes of homelessness, such as affordable housing access, job training, educational opportunities, and preventative health care. A continuum of care is a planning body that coordinates and funds services for homeless families and individuals, as HUD requires. It is a coordinated system that oversees and monitors homeless individuals and families navigating various housing and services. The objective is to prevent and eliminate homelessness while reducing trauma and displacement. Continuum of care programs oversees planning, operating, and developing the application process of funding. They also supervise and manage the homeless community, which includes conducting homeless population counts, managing emergency systems, and offering prevention strategies, as well as assistance programs. To be considered successful in ending chronic homelessness, a COC must have no chronically homeless individuals, or the number of individuals experiencing chronic homelessness should not exceed 0.1% of the total number of individuals reported in the most recent point in time, or 2% or 3%, whichever is greater. This must be retained for at least 90 days. The U.S. Interagency Council on Homelessness and the Department of Housing and Urban Development have joined forces with other council member agencies to establish specific criteria and benchmarks for ending chronic homelessness. This collaborative effort will guide communities as they strive to achieve this goal through a continuum of care. The Erie County Department of Human Services serve as Erie County's collaborative applicant for the HUD Continuum of Care program. Addressing homelessness through a comprehensive approach, they provide a range of services such as outreach, housing, case management, and supportive housing solutions. The department coordinates funding from various sources, including HUD, the Pennsylvania Department of Human Services, and the Substance Abuse and Mental Health Services Administration to support homeless and housing programs. Additionally, it oversees local provider agencies as well. So how does this connect to Erie County? Youth homelessness in Erie County has, as you can see from the data, it's pretty high. According to the Erie County Department of Human Services, over 800 people experienced homelessness in Erie County on a single night in 2023. This number includes people of all ages, races, and ethnicities. Of that number, over 100 were young people under 18. The rate of homelessness in Erie County is lower than the national average, but is still a significant problem. In the 2021-2022 school year, over 1 million homeless students were enrolled in schools across the US. This number can be further broken down by subgroups such as unaccompanied homeless youth, migratory children and youth, English learner students, and children with disabilities. The policy department of Hope Philly has identified a concerning trend of homelessness in Pennsylvania. According to their findings for the 2021-2022 school year, over 40,000 children and youth were reported as homeless. Specifically in Erie, the number of homeless children and youth has seen a significant increase from 778 to 946 within a span of 2 years. This sharp rise in the number of homeless children and youth is a cause for concern, and urgent action is required to address and combat this issue effectively. There are a variety of factors that can contribute to youth homelessness in Erie County, including poverty, lack of affordable housing, family conflict, abuse, neglect, and mental illness. Factors that contribute to youth homelessness include family conflict and abuse, economic hardship and poverty, lack of affordable housing, LGBTQ plus discrimination, issues within the foster care system, human trafficking, and mental health and substance abuse. These factors can lead to youth leaving or being kicked out of their homes, forcing them into situations where they might have to double up, couch surf, or find shelter elsewhere. It's important to note that youth who are doubling up for or couch surfing may not be counted in official homeless statistics. So the actual number of homeless youth could be much higher than reported and seen in the tables. We're going to take a look at some successful models. So Valley Youth House in Lehigh Valley, and then Saver program in San Francisco. The Valley Youth House is a nonprofit organization that provides emergency shelter, supportive housing, and outreach services to the homeless and at risk. With 80 plus programs and serving 15 counties in eastern and central Pennsylvania. Founded in 1973, Valley Youth House has helped over 22,000 youth and their families. The organization aims to help young people achieve their desired futures by providing genuine relationships that support families, ensure safe places, and build community connections. As I mentioned earlier, Valley Youth House offers a range of services to help homeless and at-risk youth, including emergency shelter for up to 30 days for youth age 12 to 21, transitional housing for up to 18 months for youth age 16 to 21 who are working or attending school, street outreach, drop-in services, and case management to connect youth with the resources they need. Individual and group counseling to help youth address mental health challenges. Summer camp, help with education and employment opportunities, independent living skills, trainings such as budgeting, cooking, and childcare. Family support for families of youth experiencing homelessness. And intervention services such as certified peer specialists, family-based mental health, family preservation program, functional family therapy, and other counseling and supportive services. Another model is the State Over program at Buena Vista Horace Mann School in San Francisco. It is a one-of-a-kind initiative that provides temporary shelter and support to families experiencing homelessness and have children attending this district or other schools within that district. The program aims to help families experiencing homelessness achieve short-term stability and connect them with resources to find permanent housing solutions. It is a partnership between the San Francisco United School District, the San Francisco Department of Homelessness and Supportive Housing, and other community organizations. It was launched as a pilot program in November 2018 and later expanded district-wide due to high demand and the success. The STAYOR program is a vital initiative that offers immediate shelter and essential support to homeless families with children in the San Francisco School District. This innovative program is based within a school building and provides overnight shelter, nutritious meals, hygiene facilities, and crucial connections to further resources. Notably, SOP results from a collaborative partnership between the San Francisco United School District, the San Francisco Department of Housing and Supportive Housing, and various community organizations demonstrated a unified effort to address homelessness in the local community. It was launched initially as a pilot program in 2018 and was a resounding success that led to its expansion across the entire school district. garnered widespread acclaim for its efficacy and cultural responsiveness. SP has become a standout model for tackling the issue of homelessness within the education system. The program operates 5 days a week from 7 p.m. to 7 a.m. and is available 24 hours on the weekends and holidays, ensuring round-the-clock support for families in need. The overarching goal of SOP is to offer short-term stability and facilitate long-term housing solutions for homeless families. Eligibility for the program is based on having at least one child enrolled in the San Francisco United School District school, excluding charter and private schools, making it accessible to those who need it most.
Another program is an emergency shelter located at Donovan, 12 hours of care to students affected of the Unified School District, along with their guardians and family members. Something similar to a care, offer food, following born care, and students. Families around 60.
So, in conclusion, homelessness affects people of all ages, especially youth and those experiencing mental health issues. Doubling up with family or friends while not technically homeless creates instability and increases the risk. Models like the Stable Program and Value House are examples of many successful strategies that are active across the nation. Raising awareness, advocating for solutions, and supporting organizations that provide services and resources in Erie County are key steps toward ending homelessness. As Erie County's continuum of care, Erie County's Homeless and Housing Coalition brings stakeholders together to address homelessness. The Erie COC offers a coordinated approach with resources like shelters and support services. You can volunteer and join Erie's home team by visiting their website at endhomelessnesseriecountypa.org. By working together, we can create a future where everyone has a safe place to call.
Damali, that was excellent. Perhaps we could stop sharing screens so that we can increase bandwidth. I think Ben is going to join us momentarily. That was excellent, and information rich, to say the least. I think it's one of the better presentations we've had with our Raimy Fellows, and I appreciate it, and I thank you for it. As I'm looking at the clock and thinking of what we want to do in the Q&A, I had asked you earlier, what were the things you would want anybody listening to this program to take away from it? And you had suggested 5. And I think the first one, you've done an excellent job of demonstrating from your vantage point and what you've discovered in your research. How would you describe, or what would you say is the complexity of the homelessness issue?
I would definitely say that issues like doubling up and stuff like that, that the definition of homelessness needs to be expounded to include those to provide supports, because a lot of time if families are doubling up or young people are doubling up, they are not eligible for the resources that are available to them. It's diverse and include factors such as family conflict, economic hardship, insufficient affordable housing, and mental health challenges, which will require collaboration on all fronts to just establish a solution for this. And I think another thing is that it is considered a health problem as well too. So just it touches
It has, I don't know, Ben, you might want to jump in. It has multiple facets. And so attempting the two programs that you highlighted, the Valley Youth Program and the Stay Over program. I mean, you commend the people for doing that, but the problem, so there's so many nuances to it. It's where do you enter in? Where does one enter into it? You had the one slide. I don't think it was the slide unaccompanied homeless youth, but you had the one slide where you talked about young people. And before I get to that, I want to highlight something you pointed out, that in Erie County in a given year, this would probably be unduplicated individuals. So your data slide showed that, but you made the comment that in Erie County a couple of years ago, there were 800 people, unduplicated individuals over the course of the year that were homeless, 100 of whom were under the age of 18, which means 12% of the homeless in Erie County are technically children, or 1 out of every 8. And then you pointed out that recently, the data in the city of Erie, it was a 21% increase. So this is a problem of much larger scope, I think, than people realize. And it's everything from, I think what I want people to take away is, it's everything from the stereotype, for lack of a better word, images people have of homelessness that the media feeds them. But there is also, well, the word that just pops up, a more insidious social version of it, and that's with young people. And it's the people you pointed out to, who unaccompanied homeless youth or children, and I use the word children because they are, even though they might be teenagers and not quite, they're not exactly children the way you think of children, who are bunking out on somebody's sofa because a kind neighbor or a kind friend or the parent of a friend at school. And while you commend those people for their compassion, that actually obscures the problem, because they're not the custodial parent, and some of them are great people, but they don't have the long-term, and probably shouldn't be burdened, other than out of their just generosity and their goodness as people, be burdened with the long-term care of that. And I'm not doing a very good job. Maybe Ben can make my question more precise. But I think that of all the things that I've heard you talk about over the months that you've been working on this, that is the one that I just find most startling. I guess that wasn't a question. So there. Ben, you're muted.
So I appreciate that, Dr. Roth. Andy, thank you for calling. I too am alarmed by that in Damali. I'd love to hear any response that you have. And I think in thinking of that, going back to I think perhaps the first point that Dr. Roth had mentioned, and I think what's clear from your research and presentation, Damali, is that if I'm thinking of how I've learned from the JES's president, Dr. Ferki Faradi, that the wicked problems, and this is certainly a wicked problem, they don't have silver bullet answers. You know, there's not one thing that we could do that would then address this entire issue, because of the complexity and the layers for that. And so we think about a suite of services or ways that we can have wraparound services or handoffs. But I think it perhaps maybe comes back to access points, where people can go to get help, know that they have resources available to them. So Damali, maybe that's one of the things of, if we're thinking of those that are benefiting by the benevolence of friends or other family members that are, in your example, couch surfing, let's say, how do we then connect them to the help that may be coming from a social circle that is family or friends, to connecting them to professional resources, people that are working, perhaps not with silver bullets, but a suite of approaches. How do we find a better way to connect those experiencing this to those who are working to change lives and improve lives and offer services? So from friends to professionals, how do we bridge that connection?
That's a really great question. So as I mentioned earlier in the McKinney-Vento, school districts are required to appoint one homeless liaison, so families can get access through homeless care assistance through that. Because there are a variety of services that are provided through the school districts under the McKinney-Vento. Another one is our continuum of care, which is the Erie County's Homeless and Housing Coalition, or Erie Home Team. They, like I said, mentioned earlier, you can connect with them on their website, and homelessness eriecountypa.org. They host bi-monthly meetings as well. And if you do need help with connecting to professional services, they have the number 814 shelter to help with that. And also you can access additional help through 211.
So I know we've asked you to give this wonderful presentation, and you've done a terrific job, Damali. I think immediately there, hearing you offering up those immediate connections from school districts to points of contact within a place like Erie County, I would say it would be terrific if we follow this conversation up, one, by putting that information in the comments section of the Facebook post, and then I think also in the description of where this video will be housed on the JES's YouTube page, but I think also the JES's website. You know, I think a distillation of the points that you've covered would be so valuable to have, because perhaps those experiencing it might not go there, but those who know somebody who's experiencing it, or those who may be volunteering at places that would be serving this population, can find ways to then connect them with resources. Because I can't help but wonder, with one person in a school district, that suggests to me that would vary from school district to school district in terms of the number of students being served, and that perhaps that one person, if it's just one or if it is several, they may be overburdened in terms of the amount of resources, the amount of folks that they'd be working with. So maybe this is just one more way to get the word out and provide some of those connections. That's at least my thought. Dr. Roth, do you have other questions that you want to start, or points in the conversation you'd like to steer us as we unpack more of Damali's excellent research?
Well, one of the things Damali and I had talked about, and she wanted me to be sure to emphasize, is Damali, you pointed out that we can all be part of the solution. For people listening who may not work in a social service agency or may not work in a school district, but they're listening and they would like somehow to help, do you have any suggestions about what they could do?
Yeah, I mentioned it earlier, but the Erie County's continuum of care, like the Erie County Home Team, they are start because they do provide a lot of the resources, and they go out for a lot of the funds as well to help with the homeless assistance. Like I said, you can visit their website at homelessness eriecountypa.org.
That was endhomelessness.eriecounty.org.
And homelessness eriecountypa.org.
Okay. We should post that, Ben.
Yeah, and like I said, they do have, I believe, bi-monthly meetings. So share your opinion. Just like I said, raise awareness of other homeless activities that you notice.
That's excellent. I mean, I think that's important, because I know Jeffersonians, the people who come to Jefferson programs and the people who monitor our Facebook page and website are actually community activists. A lot of them are. They are people who just aren't bystanders, that they would like somehow to be involved. And so that's a great tip. End Homelessness, Erie County, PA.org for tips on how you could actually become a part of this. One of the things I'm going to suggest, and I think Ben would be amenable to this, your presentation was so good, Damali, and the information was such that I would like to ask you if you'd be willing to deliver it for a couple of different Jefferson audiences, maybe at some of our satellite campuses, if not at the Jefferson Society on State Street itself. Because I think the material and the information that you've shared and your insights are too valuable for a one-off. And I know it has an afterlife on our website, and it has an afterlife on our Facebook page, and it has an afterlife on our YouTube page, but there's nothing as impactful as someone hearing you in person.
I would be open
I'm
to
not
that.
going to put Ben on the spot, but I'm sorry, Damali, I talked over you.
I said I would be open to that. Like I said, I didn't really know what homelessness was, and I'm pretty sure there's a lot of people who just misunderstand what it means to be homeless. Like that doubling up considered hidden homelessness. That's like a point that I never even would have thought of. I was just like, oh, it's just a sleepover, you know. But I think just expanding that awareness of homelessness, I would be very open to doing that.
Thank you. I think that's really important. Ben, I mean, you're the moderator.
So yes, 1,000 times over. I think that's part of Damali, what you're actively calling for is spreading more of this information. And I'll say in real time, there is an apparent hunger for that because we have somebody in the Q&A section who said with a large percentage of homeless children in Corey School District, they'd love to have this program in person, where the JES is so proud to partner with the Corey High Ed Council to offer programming out there. So already you've got one of the satellites saying, please bring this to us. So Damali, I think more is the answer here in terms of getting your information out and connecting you with audiences and helping connect them to the resources that they may need or be able to connect those that they know who may need. We do have a question coming in from the audience. This person's observing, sharing first, and they acknowledge they came to the conversation a little bit late, but they're acknowledging that they had just moved from Los Angeles about 3 years ago to this area. When this person left there, an estimated 60 to 70,000 people experiencing homelessness were in the city. One component was also families and individuals who were working in low-level jobs but living in their cars or RVs. And they apologize for showing up late in case this is already covered. But are we seeing this in this area? People living out of transportation, automobiles, and still engaging in some way. They're part of a workforce, but they're otherwise disconnected from a permanent residency. Damali, can you speak to that at all?
I can speak to a little bit about that. The home team did put out a study to figure out the unduplicated numbers of youth, especially experiencing homelessness, and they did see that there was a significant amount who were living in cars, RVs, and just to get by every day. So yes, it's prevalent.
So not just a problem in Los Angeles, but also a problem here and something that we'd be on the lookout for. Dr. Roth, back to you with more questions or points of topic you'd like to explore a little bit more.
Well, Damali has pointed out that Erie County is taking action. She already gave us a contact that people could have to do that. I think it's interesting the two models you showed. Ben's reference to a wicked problem, I think, is homelessness is definitely a wicked problem, which has multiple causes and no simple answer. But there are people with answers, or at least the attempts of answers. And I was particularly taken by the Lehigh Valley Youth Home. One of the questions I had is it's a 501c3, and they've existed now for almost 50 years. I think, if I remember correctly, they were founded sometime in the 1970s. How were they funded?
So they are funded by a variety of resources, so government, private, other public, monetary donations as well too. So it's a variety of resources just coming together. So I know like the United Way of Greater Lehigh Valley speaks about them. I believe they're also accredited as well too. So they're just one positive example of what it takes to be collaborative as well too.
I think those two, I'm noticing we're near it. In fact, we're not near, we're at 1 o'clock. As we wrap this up, I think there's a note of hope in those two examples you gave, that in fact, there are programs or at least models of programs that can address this issue, at least parts of the issue, not all of the issue, and that it's possible that someone in Erie County, some district, school district, some group might be interested in attempting to replicate one of those. And so I think you're sharing that is a very important contribution. Ben, I think we're probably ready to wrap up.
So we are so close to wrapping up, but I can't help but ask just one final question for Damali. Damali, of all the things that you examined, and you can answer this as briefly as you'd like, what really surprised you the most in terms of it grabbed your attention when you were looking at the numbers, the research, and what was happening? What really surprised you? And I think to Andy's point of what you just illustrated, and maybe this is a reiteration of that or something in addition, what gives you hope for how we're addressing this wicked problem, this critical issue in Erie County? So what surprised you in your research? And then what gives you the most amount of hope that we're working toward a solution, a betterment, and a better pathway forward for those experiencing homelessness, particularly youth?
I would say the numbers of children and youth experiencing homelessness in Erie County alone, it was like above 900. In the 21-22 school year. And then like if you don't account for, which they do not account for the doubling up, that number is probably way higher than what is reported at the 900. So we might be seeing thousands, there might be thousands of children and families who are experiencing homelessness. So that still surprises me with the numbers. Our most vulnerable population is so exposed to such abuse and other exploitations. And I guess my hope is that we do have a continuum of care. We do have a lot of organizations and individuals who are fighting for ending and preventing homelessness. There's a lot of behind the scenes that I get to witness where there's collaborations between like the public, private, and government levels of organizations. So it is happening. It's just not as quick as it should be, but it is happening.
And I think conversations like today's helps accelerate that pace and is
Absolutely.
one more shoulder against the wheel of progress to drive us a little more quickly. And in Damali Donovan, Raimy Fellow, thank you so much for sharing your research, your insights, your knowledge, your expertise, and all that you found. We are so appreciative of the work that you've done. Dr. Andrew Roth, thank you. Scholar in residence at the JES and director of the Raimy Fellows Fellowship Program for guiding this conversation, for encouraging this research, and really supporting this and creating a space for conversations like this to happen that actively help connect people to resources they need and the information that can help them make better decisions and have a greater impact. And of course, lastly, thanks to all of you for tuning in and watching, whether you were watching in real time with us on Zoom webinar, or you were watching the live stream on the JES Facebook page, or if you're streaming this on demand, watching a later date. Thank you. I know we encountered some technical difficulties. We really appreciate your patience. And I think the great thing we heard during this program, amongst the many great things, was that Damali Donovan is willing to talk about this again and perhaps bring this to a neck of the woods in your corner of Erie County. No doubt we're going to have more research and more information about this, including some of those key points that we talked about. We'll have that posted on the JES's website, as well as our Facebook page, as well as our YouTube channel, where this will be posted. For all of that information and more, you can head over to jeserie.org. where you'll find also videos of past presentations, including Raimy Fellows. You'll be able to stream those on demand. You'll find access to the myriad publications that we have, including reports, essays, timely writings like Dr. Roth's book notes, and of course, more information also about the JES's Civic Leadership Academy and its Raimy Fellowship program. Be sure to connect with us on your social platforms that you use. Like us on Facebook, connect with us on LinkedIn, follow us on Instagram, and subscribe to our YouTube channel. For the Jefferson Educational Society, I'm Ben Spag, and thanks for listening and learning with us.